Mihailovich is the Community Advocacy Director for the American Heart Association in New York City. He's a native New Yorker and has lived in 4 of the 5 boroughs. He's a longtime community organizer, and as part of AHA's advocacy team, he works to pass policies and fund programs that give all New Yorkers access to what they need to be healthy. Welcome, Greg. So happy that you could join me here today.
Thanks for having me, Rose.
You're AHA's Community Advocacy Director. What does that mean, and exactly what do you do?
Well, I mean, what we do is we try and level the playing field. Our advocacy team, we work to pass legislation and fund public programs that give people what they need to be healthy. Healthy food, opportunities to live active lifestyles, access to quality healthcare, living tobacco-free. So anything we can do to kind of make it easier, make the healthy choice the easy choice, and get that support from our government, whether it's local, state, or federal. That's what we do. We're leveling the playing field.
Can you tell us a little bit about the food issue, the food security issue here in New York? What does it look like right now? And why is it such an important issue to address?
Well, according to the city's most recent report, 1.6 million New Yorkers are facing food insecurity. That's 1 in 5.
Wow.
And food insecurity is just not knowing where your next meal is going to come from. So that's a real problem. And the caveat there is that report is basically pre-pandemic numbers. So with the rise of unemployment and people losing income, that number is probably going to be much higher. We're estimating there's probably as many as 2 million people are going to be food insecure. And the city made significant steps in providing emergency food deliveries, but that's a short-term solution. So what we're trying to do is we're trying to make sure that the city does what it needs to do to make sure that people can get healthy food on their tables to get them through this pandemic and live longer and healthier lives separate from the pandemic.
Yeah, and on that issue, let's talk about the current state of our local government. There's a lot of change going on right now in New York City, and we're expecting a brand new administration soon. Can you talk a little bit about that and what it means for the AHA Advocacy Group?
Well, yeah, you're right, Rose. We're in for an interesting time because in New York City, most elected officials are term limited, and we have the mayor is term limited, and out of the 51 council members, over 40 of them will be leaving due to term limits. We're going to have new borough presidents, so we're facing an entirely different administration. And when you have a new mayoral administration and new council members, there's new council leadership. We're probably going to have different people running the different agencies, Department of Health, Department of Education. And then the interesting factor is this is also going to be the introduction of ranked choice voting in New York City, where people aren't just voting for their number 1 candidate. You actually rank your candidates in the order of your preference, and that adds an additional wrinkle to this. So it's just
It'll be an interesting year.
It's going to be an interesting year, and because it's such a great unknown, there's a lot of opportunity for us to kind of build those relationships for long-term success. So with a lot of new elected representatives, there's an opportunity for us to kind of introduce ourselves, make a case for what we do is why what we advocate for helps people live longer and healthier lives, and really kind of advance our policy agenda in New York City. So there's some uncertainty short-term, but there's some fantastic long-term possibilities here for the work we do.
Okay, promising, very promising. As you know, my work with AHA has been around food access and nutrition security throughout my native borough, the Bronx, right? I've been proud to fund the operation of the year-round farmers markets in the Bronx. Why are farmers markets so important to the community, especially during this challenging time with COVID-19?
I mean, the short answer is that it increases access to healthy food, fresh fruit and fresh produce. I mean, we've all heard the term like food desert, where they don't have food, or more accurately in the city, it's food swamp. They refer to it's like, well, there is food, but it's fast food, it's processed food. So the idea that if a neighborhood doesn't necessarily have a grocery or a grocery or supermarket, that this pop-up farmers market is providing access to this fresh produce, and it's usually in season, locally grown, in the region, and much healthier. But there are limitations, because not everybody has access to a food market. As you know, with your work in the Bronx did not have year-round food markets, so their access would be cut off, and they would have to leave the borough during the colder months. So, I mean, that it's a great solution, but not everyone has access to that. And again, that comes to us leveling the playing field, making sure everyone has access to the farmers markets.
Right, and we'll get more of them. Work on that this year and next year.
Hopefully.
Can you talk to us a little bit about the New York City Health Bucks and SNAP incentive programs? How do these programs positively impact health? And what barriers come up when it comes to New Yorkers using these incentives for healthy food, and how can we address them?
Well, SNAP, the Supplemental Nutrition Assistance Program, was formerly called food stamps. That's the kind of federal entitlement program that helps people who are facing food insecurity put food on their table. And that's a great program, but that's handled on the federal level, and then some of the qualification on the state level. But locally, we have, like you said, these healthy food incentive programs, where people who are enrolled in SNAP, they're available for additional benefits. So with Health Bucks, if you use your SNAP benefits at a participating farmers market, this year, for every $2 you spend, you get an additional $2 in Health Bucks, up to $10. So if you spend $10 of your SNAP benefits at a farmer's market, you get $20 of fresh produce. And that is really important, because one, it's doubling your buying power of your benefits. Obviously, that's the thing. And you're increasing the quality of your diet, because you're getting access to these healthy foods. But also long-term, it teaches healthier habits. The idea that now you're shopping for healthy produce, you're learning about produce, the idea that you have to now coming up with recipes to use this, and it's just a longer term health strategy. You learn these healthy habits, and it results in better long-term health outcomes. But again, the barriers are not everyone has access to these farmers markets. The ones that they do, if it's out of the borough, sometimes it's not worth it. If it's going to take 2 hours round trip on mass transit to get to the farmers market, and you lose your entire Saturday afternoon, sometimes people make choices that it's like, I can't go there today. And then also, strangely enough, that not everybody who enrolls in SNAP is aware of the program. And I think that's kind of a missed opportunity with outreach from the city, that someone enrolls with SNAP and they don't know that these incentive programs exist. But the city is making more efforts. They've actually introduced a new program called Get the Good Stuff, which is similar to Health Bucks, where there's participating supermarkets. If you use your SNAP benefits on fresh produce, you get reward points to your next purchase. But again, it's 6 supermarkets in New York City. They're expanding it, but it's only 6 supermarkets. So again, there's an access issue. So how can we let people know more about the program? How can we get more locations involved? How can we get more people availing themselves of the program? So
it's your daily job, right? It's something you struggle with every day. And we're getting the word out there. We're working together to get this done, right?
Yes.
We also implemented a healthy food prescription program that allows clinicians to prescribe fruits and vegetables to hypertensive patients. So right now, the Moshulu Montefiore Community Center is prescribing Healthy Bucks, which can be redeemed at Norwood Farm Stand right now. Now, what can we do to expand these programs so that they can reach more people?
See, that is interesting. This idea of like food as medicine, food prescription programs is kind of an emerging space. And like you said, it's an opportunity where someone who has hypertension and is filling a prescription for hypertension medication gets these Health Bucks that then they can turn around and improve the quality of their diet. And the Health Bucks themselves can be redeemed by anyone. So if it's someone who qualifies, they don't necessarily have to be a SNAP. New York City has, New York City has had a food prescription program called Pharmacy to Farm, where exactly like you said, they would get these $30 worth of food bucks, but it was federally funded, and that funding has expired. So the city is sunsetting the program with the understanding that they want to review the data and see the effectiveness of it.
Hmm.
And one of the things that we're doing is we're advocating for the city to actually reach into its own pocket to fund these programs. It's great that you got federal funding, but the science is emerging that this is really kind of an impactful way, one, to increase the quality of your diet, but two, help treat hypertension, help treat your high blood pressure, which is obviously going to result in better long-term health outcomes. So we're trying to get the city to reach into their own pocket to keep this funding, keep the program funded and moving forward. So one of the many things we're trying to get the city to do.
That would be great.
Yeah.
Now, I want to just like shift to healthy food for children. A few years ago, the federal government issued a rule that weakened nutrition standards for school lunches. Big problem, right? I remember that. My children going to school. How did AHA respond, and what and did that impact the New York City school children?
Well, see, that's an example of like the different layers of AHA advocacy, because since this was a federal rule, we have our advocacy team in Washington, D.C. immediately mobilized. They were coming out against this on the federal level in D.C. with our federal lawmakers. Locally, what we were doing across the country is we were going to local city governments and we were going to school boards to be like, it doesn't matter what the federal rule is, you should keep the standards where they are. You do not need to drop the standards just because the rule says now you can lower the standards. So that was kind of the dual pronged effort that we were doing. And in New York City specifically, we're actually really lucky that New York City's school food nutrition standards often meet and even exceed the federal guidelines. So when we reached out to the Department of Health and the Department of Education, they assured us that they had no intention of rolling anything back. So the New York City kids were still going to get their nutritious lunches. But then our role, as opposed to being an advocate, becomes more of a watchdog, where the idea, it's like you make sure that, this is what you said and you hold them to their word. So since that rule has since been a judge struck down part of that rule, so I don't think it's going to be an issue as much going forward. And we've had a administration change, so in the short term I don't think it's going to be an issue, but it's an idea of how we're approaching a challenge from different levels of government. So
great, you are out there doing your work, boy. Any closing thoughts or anything else you'd like to share about AHA's work and advocacy?
Well, I mean, the thing about advocacy is that it only works if we get everyone kind of moving in the same direction. You don't win on an advocacy issue because you're right. There are no moral victories. So, AHA is a science-based organization. We use the best science and the best data, but that doesn't mean we win on these issues. I mean, with the way we win on these issues and kind of level the playing field is applying direct pressure to lawmakers to get them to do the right thing. And we need, as many people speaking up for that as possible. It's great that if I'm talking to a council member or someone in the mayor's office, but it really is as many people expressing their opinion and really making it. And that's sending emails, that's making phone calls, that's showing up for meetings, that's posting social media, just making sure that they're aware of what these issues, and we make it easy. We have a platform which you're a member. You're the Cure is our kind of advocacy platform where we encourage everyone to register at you'rethecure.org, enter your information, and if you put your address, you will not only get the federal alerts, but you'll also know what's going on in your community and opportunities to get involved. So
why is it important for people to get involved?
Getting involved on the local level of government is probably the most impactful way, because these are the people who are making decisions that directly affect your lives. You think about the schools you go to, the food you have access to, the medical care that you have, like these are all decisions that are first and foremost made on the local level. So getting involved locally really has an incredible impact. And, you know, as we said, we have some real opportunity here in New York City. And as things normalize and we get more to in-person opportunities, there's going to be opportunities for rallies, for public events, for meeting with lawmakers. And, you know, to the work you've done, Rose, with the farmers markets, there's going to be opportunities to engage the community and really help people, you know, live longer and healthier lives. So signing up for AHA's advocacy platform, you'rethecure.org, you really will be kept in the loop about what's going on, what your opportunities are to get engaged, how to share your story, why this is important to you, why it matters that people have these opportunities, and we really can make a difference locally. And that filters up, especially in New York City, where we're also we're often an example to other communities around the country. So we really get a chance to lead.
Okay, to all our listeners out there, you got that, right? Sign up, help us make the city healthy the way we should be. Thank you very much, Greg.
Thanks for having me, Rose.